You've done everything right, haven't you? You've kept your doctor's appointments, done the tests, said yes when they told you to. Because you care. You care about staying healthy, about being here for the people you love. And that's a beautiful thing. But what if I told you that some of the very tests you thought were keeping you healthy could actually hurt you now? Let me tell you about Helen. Helen was 73, full of life, still volunteering at the library and baking pies every Sunday. She came in for her yearly checkup, and her doctor said, "We should run some tests just to be sure." That just to be sure turned into a series of appointments, scans and a biopsy that left her bruised and scared. And in the end, they told her it was nothing. She looked at me with tears in her eyes and said, "All of that, for nothing. I wish someone had told me I didn't need it." I don't want you to go through what Helen did. I'm Dr. Anthony, and in the next few minutes, I'll walk you through 5 common health checkups that seniors over 70 should think twice about, tests that sometimes do more harm than good. And I'll share more stories, real stories, like Helen's, so you can see just how important it is to ask questions and make the right choice for you. 1. The PSA test for prostate cancer for men. Joe was 74, strong, independent. His PSA blood test came back a little high, nothing dramatic, but enough to send him down a rabbit hole. Urologist, biopsy, surgery. And after the surgery, he told me, "Doc, I can't go anywhere without a pad in my pants." The truth is, at his age, the small cancer they removed probably never would have hurt him. If you feel fine and have no symptoms, think twice before saying yes. 2 colonoscopies. Maria was 77, bright, funny, and already had 3 clear colonoscopies in her life. But her doctor pushed her to have another just to be sure. During the procedure, her colon tore. 10 days in the hospital, a long recovery, and it turned out there was nothing there. After 70, especially if your earlier tests were clear, the risks of colonoscopy often outweigh the benefits. 3 pap smears and pelvic exams for women. Then there's Evelyn. At 72, she'd been through decades of pap smears, always normal. But a doctor insisted she keep coming back for them. One day, a suspicious result sent her into weeks of testing, only to find nothing. She sat in my office and whispered, "I didn't know I could stop. If you're over 70 and your past pap smears were normal, you can..." 4 heart stress tests. Frank was 75, no symptoms. His kids talked him into a stress test just in case. The test showed something suspicious, which led to a stent, which led to complications. Months of rehab for a problem that wasn't even bothering him. If you don't have chest pain or shortness of breath, you don't need this test just to check. 5 whole-body scans and routine CT scans. And finally the high-tech scans. Mrs. Green came in after a whole-body scan showed a spot on her lung. Weeks of anxiety, a painful biopsy, and at the end, it was nothing. These scans find shadows, harmless ones, but once they're found, they're hard to ignore. These 5 tests, the PSA, colonoscopy, pap smear, stress test, and whole-body scan were designed to help people. And in the right situation, they do. But at your age, they can take more than they give your time, your energy, your peace of mind. You deserve care that helps you live better, not care that hurts you. Have you ever been through one of these tests? Did it help or hurt? Share your story in the comments below. Your words could help someone else feel less alone. And if you found this video helpful, give it a like, so more seniors can see it and protect themselves too. You've looked after everyone else for so long. Now, it's time to look after you. You can ask questions. You can say no. You deserve care that respects you, not just your numbers. Thank you for watching. Take care of yourself